What town did you grow up in, and did it influence you or inspire you to do what you do?
I grew up in a small community. It's a rural area called Madden, M-A-D-D-E-N. It's between Carthage and Philadelphia, and relatively close to Silver Star Casino. Very, very small town. We had a three-way stop sign. And the house that I grew up in, it's my parents' house to this day, is my grandfather's old medical clinic. And his house across the street was my cousin's house. And so, anyway, growing up and seeing him and his retirement years still dispensing medical advice and medication from his in-house pharmacy, I probably had some influence on my choice to go into medicine. The second thing was, my mom was a school teacher. My dad worked as a plant manager for a company that manufactured electric motors. Anyway, both of them were very instrumental in my choice / being forced into going into medicine. And so I owe a lot to them, obviously, in regards to my career selection. I feel like it was a wise choice on their part, and I've thoroughly enjoyed it to date.
What's the difference between Botox and Dysport?
Well, name, in a nutshell. Botox is it's a paralytic agent, and it was the trademark name of the first product to market. It doesn't enjoy the same name recognition, but the medication and the source that it comes from is exactly the same. Multiple studies have been done looking at the two medications. Is there a quicker onset of action with one versus the other? Is there less pain associated with injection one versus the other? Is there more potential for drift with one? And the answer is no. And for a period of time, Dysport, in an attempt to gain a larger part of market share, actually could justify offering their product at cheaper rates. Now, both of them fairly similarly used, and pricing is about the same. But as far as efficacy, longevity, effectiveness, etc., in my opinion, they're essentially the same, a Ford and a Chevrolet.
Okay. We get a lot of questions regarding laser liposuction versus traditional liposuction. What's your opinion?
Laser liposuction, in my opinion, is more of a gimmick. It's an advertising ploy. It sounds attractive. Lasers, people think of as having some sort of magical capabilities. Lasers are just simply an amplification of a single wavelength of light. In this particular situation, it's amplification of a wavelength of light that will melt fat. So the idea is that you take a laser fiber, and then you use it, and you melt the fat in the person, and then the oil, if you will, that's left over from that is either suctioned out or can be absorbed by the patient's body. Traditional tumescent liposuction, in my opinion, is tried and true, long track record, relatively inexpensive because you don't have all the disposals associated with laser liposuction, and as a consequence, it's a better buy from the patient's perspective. Laser liposuction was touted as something that would tighten the skin. Hard for me to believe that it actually could tighten the skin unless you got right up under the skin, and in that situation you had more of an injury for thermal injuries to the patient, discoloration of the skin burns, etc. So again, to me, tumescent, traditional suction-assisted liposuction trumps laser liposuction.
How do you keep it natural in plastic surgery? What's your conservative approach?
Well, you have some people who actually want a plastic surgical look or a more fake look, particularly, say, for example, with breast surgery. And then you have patients who, their biggest concern or fear or trepidation about having surgery is that they're afraid that they either wouldn't look like themselves or that they would look, quote, overdone. And so what we do is first we elicit a good history. We ask the patient, what do you want? So in implant selection, for example, in breast augmentation, an ultra high profile or a high profile implant may give more of a made or done look, and a moderate or moderate plus implant might give more of a natural look. So again, the patient would look at photographs, say, I like that, appears better, or this is more what I want to look like, and then obviously we tailor our operation to that. With things like facial rejuvenation, very, very important to have a natural look. Everyone always refers to Kenny Rogers or Dolly Parton or Phyllis Diller as what they don't want to look like. And to me, I don't want anybody to ever look like a wind-blown lizard or anything of that nature that you would be embarrassed to say, yes, I did that woman's facelift. The way that you combat that is that you pin your lifting on the deeper layers. One, it's going to last longer, and two, it allows you to get a better final scar, and then strategic positioning of those scars.